Hi everyone. I just wanted to give you guys a brief introduction on my journey of trying to figure out what my diagnosis was. It started January 2018 when I was rear-ended in a car accident sitting at a red light with my kids. Both of my kids were fine. They were 7 and 9 years old, but my foot was on the brake. My left arm was extended because I was taking a sip of coffee with my right hand, and everything, my whole torso jarred forward, giving my hip a posterior moment. So looking back, figuring out the moment of impact would have been very helpful in determining my diagnosis. And I had some great doctors, but the pelvic area and hip are so intertwined and almost cross-wired. So if you're having pain at your SI joint, it could be your hip, and likewise. So it's really hard to differentiate where the pain's coming from, and when you have pain everywhere, that also doesn't help the doctors to find a diagnosis. So my journey included a year and a half of not knowing what my diagnosis was, 7 cortisone injections, including one in the SI joint. They thought it was a SI sprain. Then 2 in the piriformis muscles, the piriformis muscle on the right side, 6 weeks apart from each other, because that seemed to help reduce my sciatic nerve pain and numbness. 1 in the hip joint, 1 in the ischiofemoral space, another one in the other hip because I was compensating so much. I was in a back brace, a Boston overlap brace, for 6 weeks to try to reduce motion in my SI joint when they thought it was a SI sprain. That did not help. Then I was in an SI belt to try to reduce pelvic mobility. So localizing the containment of my pelvis and reducing mobility more locally with the SI belt. That helped a little bit. Finally, we ended up doing a Tesla 3D image MRI on my hip after I got a second opinion from a different physical therapist who determined they thought it was all hip pain. That MRI, the doctor came in to talk to me and go over the results. He got back up and said, "I'm going to go finish with my other patient." And then he came back so he could sit and talk with me further. That determined that I had ischiofemoral impingement syndrome, a full tear in my right hip labrum. The ischiofemoral impingement, my femur was collapsing towards my pelvis, pinching off all the soft tissue, including the sciatic nerve. My right pelvis was tipping anteriorly and internally rotating, pinching off, the hip flexor was spasming and pinching off my femoral nerve. So I kind of had a lot going on. When I went for my second opinion, I actually went with the thought of maybe it's all in my head because nobody was finding a diagnosis. It included regular MRIs, x-rays, 2 different PTs, a year and a half in physical therapy. So I obviously thought it was all in my head at that point. But the Tesla 3D MRI is specific enough to determine if there's a labral tear. The regular MRIs do not always pick it up. So maybe something to entertain if you feel like you're possibly have a labral tear. All right. What else? So I had hip surgery. They repaired the labrum, they sewed it up, and then after surgery, because I compensated so long for a year and a half, modifying my gait, which is the way you walk, my muscles and tendons on my right lower extremity were still spasming, slightly contracted. So I still had nerve pain from the femoral and sciatic nerve being pinched off. So then they ended up doing EPAT, E-P-A-T, which is technically an experimental procedure, but they do it over in Europe without question. So that is actually, they decided that it was tendinopathy. So it was almost a tendinitis at the insertion point of my adductor, medial hamstring, and hip flexor. So what the EPAT was, so it looks like an ultrasound machine, but it really irritates wherever they're putting it. So for me, it was at the insertion points of those muscles, because my body was thinking that was my baseline and it wasn't healing anymore. So when they irritated it, each treatment, my body realized and triggered, hey, this is an injury, we need to heal it. So it increased blood flow and healing, and you weren't allowed to do any ibuprofens because you needed to let the body respond to it. So that did help. The thing that helped a lot after that, once I was out of that acute inflammation phase and my nerves started responding without causing neuropathy or nerve pain down my leg that was almost hot, oversensitive. I could feel every fiber when my pants slid across my calf. Oh, it was awful. Even standing in the grocery store line, I wanted to cry. My adductor, anytime I wore jeans, it would compress on it and cause numbness immediately. But as I continued to heal, and the EPAT did make a huge difference for me, I then transitioned over to dry needling. And dry needling is phenomenal, and I'll talk about that in a different post. So I hope this is helpful. Know that I'm with you on this journey. Please message me if you have any questions. I am not a doctor. I am an orthotist and prosthetist by trade, but also just a patient and a mom who was sick of not getting answers, and it was just a crazy emotional journey. I think more emotional than physical, because I always thought, someone else has it worse off than me, but everything was taken away from me physically, and it was an awful experience. And I hope my information and my experience can cut down your rehab time and trying to determine your diagnosis. All right, best of luck, and honestly, message me if I can help you at all, or you just want to vent. All right, good luck.